Thank you, Chairman Peters, and I'm sorry I wasn't able to participate earlier to hear the entire testimony, although my staff was here and we'll get it all. I was at the ceremony preceding the lying in state for Senator Dole. But I'm very interested in following up on Senator Rosen's question. We're proud of what we do in Ohio, and we'll hear more about that in the second panel because we'll have a representative from Ohio. But there's a comprehensive plan there to educate and inform communities about PFAS and the potential issues. I'm pleased with that level of communication and outreach. I'm not as pleased with what we're doing at the federal level. I think we should be sharing data, testing results, other information, be more transparent. It's important that we educate and communicate with the public. So to Inspector General O'Donnell and Inspector General Rourke from DOD and EPA, respectively, let me follow up a little bit on that and talk about what we can do better. What ways can your respective agencies improve their communication to states and communities about PFAS, and particularly as research continues to evolve about these PFAS chemicals and their impact on health outcomes, which I hope will be forthcoming here in the next few years. One of my frustrations is understanding there are 4,700 chemicals involved, roughly. It's not easy, but we need to get better scientific data about what the impact is. But how can we ensure that there's an accurate and timely information sharing with the public? And maybe we'll start with you, Mr. O'Donnell.
Thanks, Senator. As I had just said, an important part of protecting human health and the environment is, of course, informing communities of the risks that they face and the pollution in their community and nearby water sources, food sources. We have at EPA OIG a growing and robust body of work on the EPA's success or lack thereof when it comes to communicating that risk. What we have found, and this is in particular with respect to PFAS, is that the states are far ahead of the EPA when it comes to addressing chemical safety and risk from those chemicals. And so I think that what we speak to often, and it's been an enduring issue that we've seen with respect to the EPA, is that in its role as partner with the states, and in particular it has an oversight role, to join and to really catch up with the states so that it can provide a consistent message across the United States.
Ms. Rourke.
In our report, we mention some of the communication and coordination activities that are ongoing, but we also highlight some areas for improvement. And so in terms of the areas for communication and coordination that are ongoing, there are really four main areas which we discussed in our report. The first was drinking water testing. We cataloged the DOD's efforts to test the drinking water for PFAS across the different communities that are impacted. Second, we took a look at the notifications to impacted populations. For example, at Camp Grayling in Michigan, we discussed with them some of their strategies that they've used, such as town hall meetings with the community to discuss the test results for the groundwater. Also, Camp Grayling officials also talked to us quite a bit about posting information on the state of Michigan's PFAS response team website, just so that the public would have access to that information. The third area was coordinating with healthcare providers so that when folks show up seeking healthcare, it may have an informed discussion with their healthcare provider. So getting that information in the hands of healthcare providers is really important at the OSD level, and then at each of the three military departments, they have disseminated information to healthcare providers to ensure that sharing of information occurs. And then the final area, the fourth area of coordination, is the annual firefighter blood testing requirement that DOD is implementing right now. So those were kind of some of the four major items that were going on. The area for improvement that we noted in our report was keeping populations such as firefighters aware of where emerging chemicals are within that emerging chemical process. When we asked firefighters at the 6 installations that we visited as part of this
Ms. Rourke, was Wright-Patterson Air Force Base one of those?
It was not.
Okay.
When we asked them about the 2011 risk alert for PFAS containing AFFF, they were not aware of that. In addition, when we asked them about were they aware of exposure risks regarding materials other than AFFF, they were not aware of that either, which kind of indicated to us that the information may not be getting down to some of the users of emerging chemicals.
Well, let's turn to DOD then quickly to talk about this. So you've identified as IG some shortcomings, and as I said earlier, some of it is because there's a lack of good research that's being done so far. It's not definitive in the case of some of these chemicals, which we need to accelerate. But to Mr. Kidd and Ms. Macaluso, talk about how you measure the effectiveness of your communications to service members, their families, the surrounding communities. I think of Wright-Patterson Air Force Base and the surrounding community in Dayton. There's been a frustration there about information sharing. Are you feeling like you are communicating the latest developments, the latest research in an appropriate way to the military and to the public who are understandably concerned about PFAS?
Senator, I believe that we are improving in our communications effort, and we have a ways to go. So as part of creating a holistic enterprise response, then Secretary Mark Esper created a PFAS task force inside the Pentagon, gave us 3 lines of effort: find alternatives to AFFF, honor our cleanup obligations, and track public health. When I briefed that program to this administration asking for its reauthorization, it was obviously reauthorized, and Deputy Secretary Hicks said, and you must improve communication and transparency. So that was a charge from Deputy Secretary Hicks that we are embarking on. We have a ways to go. I have personally met with a number of the folks that are going to be on the second panel later this morning, and we have identified a range of activities that we'd like to do starting in 22 once we get a budget, some new starts in terms of improving our training. So unfortunately, in some of the budget cuts of recent years, the training programs for our Restoration Advisory Board, our Restoration Advisory Committees was reduced. We have a best practice guide that is good, but 10 years old. I would like to go back and revisit the training we provide to our installations in terms of public outreach. I'd also like to go back and update our best practices guide so that we can get better outcomes in terms of community engagement.
Well, my time is expiring, but I hope as a result of this hearing that you will do that. Not just that you'd like to do it, but let's make it happen. And again, we need to have the research catch up as well to be able to provide more accurate and relevant information to stakeholders. Thank you, Mr. Chairman.